Hey guys, I'm Michael Allen from TravelCostaRicaNow.com, and I got to tell you where we're at first. I mean, I'd be remiss if I didn't mention we are down in beautiful Juan Tony on the Pacific side of Costa Rica, and specifically in one of our favorite places, Costa Verde. And hopefully we can pan this beautiful surrounding real quick. But anyway, we got a great video. This was a very unplanned video. We met Valerie last night, and she's got such a great story. We have to do an interview, man. This is about medical stuff. We're going to give you some warnings, some options, some things to think about. So you definitely want to watch this. Anyway, Valerie, thank you so much for
You're welcome.
coming and
My
talking. I know
pleasure.
this is going to be good stuff. All right, so we are going to be talking about medical stuff. We're going to be talking maybe a little about insurances, the United States versus the care here, and some of your experiences because they're pretty interesting, I think. So, why are you here? Okay, let's do it real quick. Valerie was in a car accident, and a bad car accident, and well, you can say what happened to you as far as what it did to your body and where did this all started?
It damaged, I was T-boned going 35 miles an hour, knocked off a road, and my Jeep went up a part of a hill, so I was twisted every direction. I have smashed discs from it that were herniations, protrusions, and bulges at the time of the accident that progressed into completely smashed, wiped out discs. And there's 5 of them total that were damaged in that wreck.
And anybody that's had back problems knows how bad back problems can be, and I am one of those people, so I totally understand. So, okay, so walk us through what happened. So now, okay, your back is getting worse. Obviously, the discs are.
Well, what happened was I had maintained a good physique after going through havoc with drugs and the first round of a nightmare in the U.S. with prednisone, steroids, Vioxx, and multiple other drugs that caused massive and sometimes fatal side effects. And because of me not wanting blood tests done, I said I'm not going to take them anymore. And because of severe weight gain, I quit taking the prednisone after the doctor said, well, that's why you've gained 110 pounds so quickly, is because of the steroid that I have you on, which I felt was more debilitating to the injury. So after getting everything back, I maintained fine, no problems for a number of years. And then I got pregnant, and the weight gain from that point and the age of the smashed discs and the problems with the discs and my bones changing after I had my son basically collapsed them the rest of the way to where they could not support my joints anymore, and the nerves were being smashed, and every step I took was excruciating pain.
So prior it was just Band-Aid approaches to keeping your back okay, like pain type stuff.
I had 2 radiofrequency rhizotomies done on my back where they do facet block injections where the nerves are burned, so you have the injury still, but you don't feel the pain. So I was able to do rehab, get all the weight off. I maintained a size 4'6" for a decade with no issues, and because I have such a strong core, it helped my injury. But then once I got pregnant and gained the weight and everything changed, those discs just compressed the rest of the way, and the only thing that I could do to save them, according to the doctor here, was to operate. And due to me not wanting to operate, I went and searched for the radiofrequency rhizotomy and other things again that did not work.
Okay,
so,
let's tell people. Okay, Valerie doesn't live in Costa Rica. She has lived in Costa Rica, but right now. So how did you get involved in doing your back stuff here?
It started by coming here almost 7 years ago to have a tummy tuck done and some other things done. From the weight loss, I had a lot of skin that was on me, and I was in such good shape that I wanted it to feel good. So I started 7 years ago by doing that and was very impressed, one, by the schooling they do here, by the fact that SEMA Hospital's major investment person is Baylor University, and it's practically almost American owned, the private hospital that's in Escazú. All the doctors there, from the plastic surgeons up, have all had immense training and are all board certified. And
I'm assuming it's more cost effective.
It is a lot more cost
effective, like a third,
because
right?
Insurance won't, one, do plastic surgery things, and it's more fair price-wise here by far. And the recovery places are fair as far as you pay a rate for all your meals. They pick you up at the airport. They take you to your doctor appointments. They basically hold your hand through the whole thing. So even if you're here by yourself, you can do it all and feel like you have a bunch of friends here supporting you.
Okay, so now let's do the comparison between the United States and here. So now you're pregnant, you have your son, your back is totally fucked.
It is toast, and because of the months and months that it was taking to get answers in the States, I got very frustrated, as did my husband, and said, that's it. you know, you need to go down there and at least find out what the problem is. So I flew down here, and in one day I walked into the ER at SEMA Hospital. I had 2 MRIs done, I had 3 ultrasounds done, and they pinpointed every single thing that was wrong with me and told me what I needed to do. And because of me being shocked that there's actually an answer for all of this, I then went to the States to continue.
You're like, this is too easy.
I thought they gotta be wrong.
this.
They gotta be wrong.
Right.
I didn't want to have an operation. That was the last thing I wanted to do, because one of my previous surgeries I had been awake for because the anesthesia, drugs, this is part of why I don't like taking them. They don't work for me. And the Versed, where they pump you so you don't remember operations, didn't work for me. And I told the doctor everything he did. So
Ouch.
I did not want to have an operation. So I went to Malibu and I saw a doctor
So back
there.
to the States.
Back to the States to confirm what they said here. I went to Malibu and saw a doctor there who said I needed an operation immediately, was very pushy to the point I was uncomfortable. And I said, whoa, I need to talk to a few more doctors. I'll be careful, but you know, I'm not doing something on Monday about this. Like, I need more answers.
I'm going to do some homework.
Exactly. So I went to Cedars-Sinai then, found 2 more surgeons, not knowing they worked together, scheduled them separately because I want as many different opinions as possible. Went and saw them, had more facet blocks done, 6 more months of tests. They billed my insurance $100,000 just to tell me the same thing that the doctor here told me in 40 minutes.
Now, had you told them, or were you kind of going in like?
I told them everything I was doing. I was straight with every doctor. I said,
so they knew what Costa Rica said.
Yes. I said, you're the second doctor that I'm seeing. And the third and fourth, I said, you're the third doctor, you're the fourth doctor. This is what the first one said. This is what the second one said. I was very open book with everybody because I wanted answers and I wanted them to know what everyone else had said so I could get truly an honest opinion from them, you know. And so I thought surely they would agree. Well, they didn't agree. They said that I wouldn't operate. So I waited. I didn't operate. And I did all these other tests only for him to say, let me go look at your films again. Went back and looked at my films and said, you know, that disc is a lot worse than I thought. I would actually remove all those. And he says, but I would fuse this. And
$100,000 later,
right,
that you already knew that you should be,
right,
that the Costa Rica already told you to do that.
Exactly. And when I went to Costa Rica, the one thing that impressed me, and it actually made me start crying, was I went in and I said to the doctor, do not give me pills. I just came from an ER where the doctor told me to maintain on Vicodin, did not give me a diagnosis. In fact, in the room when I was talking with him, said, can you please hurry up? There's more people waiting. As I'm trying to explain my problem, an ER doctor, oh yes, and he's not seen the end of me yet. So this doctor here says, I'm not going to give you pills. I'm going to find out why you hurt and we're going to fix that. And I started crying because that was all I wanted. That was all I'd been looking for years, was a doctor to tell me what's my problem and what do I need to fix so I don't hurt anymore. I don't want to take pills. I have a baby. What quality of life is that when you have a child and you're doped up on drugs all day?
Right.
So he told me what it was, and you know, I didn't believe him. So I had to go see for myself, and through my experience, I thought, I'm sure there's a lot of people that are on this end of things that don't have the chance to come to Costa Rica and get this other answer, and they're frustrated with no answers like I was finding in the States. So I want people to know that it's amazing down here for the healthcare. They don't give you drugs, they find out why you hurt, and they fix the problem. And if
it's none of this 75,000 tests and $150,000 later. Now, if I can ask you, how much was the surgery here? And how did the insurance stuff work, or was there no insurance involved, or how that?
Well, that was another frustrating part of it. Is I was told I had coverage with my Blue Cross Blue Shield for out-of-network kind of places.
Even here?
Anywhere I go. If it's at a network, it's at a network. It makes no difference where you are. But then they said later that international is different, and they will still pay at a network, but they have a price that is their max payment. So I paid $34,000 out of pocket for this operation. I had 3 discs replaced, the S1, L4, and L5 joint discs. And I spent 15 hours in the hospital after the surgery was completed, and then I left, and it was $34,000.
And how much did the insurance pay?
I don't know yet how much the insurance will cover, but I send all the receipts into them, and then they decide out of network costs what they'll pay, and then they'll send something back. Okay. So if they pay some, great. They might pay none, I have no idea, but they're supposed to pay a certain amount. Once it's fixed with this, I will never see you again. I saw
It's
him.
too good of a. It's too
once.
good, right?
Oh, it's incredible. Now I am in physical therapy because he put the discs in. He stretched my muscles back out, and I'm taller from it because I'm not. My spine isn't as compacted. So I have very, very tight hamstrings that are. It's almost feels like something's gonna snap because my muscles are stretched out from all three discs being done at the same time. But I'm a month post-op right now, and I'm doing aerial yoga, Pilates. I'm walking long distances up and down hills, and I feel amazing. And it is tight when I stretch still, but every day it gets better. I feel amazing, and this is the kicker. I'm an adrenaline junkie. I love skydiving. I was a whitewater rafting guide on a very dangerous river in the country. I don't want my life limited at all. And he said, you'll have no restrictions. You can do bungee jumping, you can jump off cliffs, you can do anything you want.
So it's just a matter of some physical therapy.
Just physical
for
therapy for stretching my muscles back out, and I'm good to go.
But so you only did this in Costa Rica because you had been here and you kind of knew. Because some people are going to be thinking, I don't know Costa Rica. I don't know what a good doctor is or who's not a good doctor. How do I even get involved in finding out something like that? You kind of knew the area. You've been down here before. How did you get hooked up in the...
The very first time I came here was to come with two other girlfriends that were having work done. And I had just gotten divorced and needed to get away. And I thought, I'll come with you guys and I'll babysit you. Because they were older women. I have a lot of older friends. And one of them was having a facelift. And the other one was actually Robert Frost's granddaughter.
Oh, really?
And was just a kick in the pants. And I enjoyed my trip here immensely with them, but I saw what they did and what they paid, and I'm like, this is like, my great grandma had a facelift, and I remember her telling me what that cost, and it was like not even a third the cost here. So I said, wow, this is something else. And I said, maybe I should get my tummy tuck done here, and that's why I went and got my tummy tuck done. And ever since then, the food here is delicious. The people are very nice and accommodating and gracious, and I fell in love with it here.
But as far as SEMA, you getting hooked up with SEMA, that was just, you kind of just went in and...
I went in with other girlfriends that had done the research prior to them going, and I tagged along and learned from them.
Nice.
And they were very particular women about making sure everything was perfect. And there was something on a TV program in the States about medical tourism that kind of piqued their interest and got them into researching it.
What's interesting about that, I mean, everyone kind of is getting that whole thing about, yes, dental, the veneers and all that stuff is cheaper here and very well done. Some of the plastic surgery, but I mean, you had to me, the back that's a whole other level of surgery.
And
I don't want people, I want people to hear your story, because knowing that the doctors are just as good, if not better here, everyone thinks that, they're not as good or something.
The fear here in why people are hesitant, I think, in doing something so risky, not that it was a risky surgery because my surgeon was top notch.
But in their mind.
But in your mind is there's no liability here. So when they find that out, well, if a doctor's not going to be liable if he does something wrong, well,
what's my recourse?
Right, there isn't any. Well, my point in doing my operation, wherever I ended up doing it, was to find the best doctor. I didn't care about liability because I wasn't looking for something to happen. I was looking for it to go perfect. So if I had the best doctor, it didn't matter if there's liability or not. I'm not looking to sue. I'm looking to feel 100%. And that's exactly what I found and got. And I feel that everyone should have a chance to have that. And the way the insurances jerk you around in the U.S., you could save up your little bit of money instead of having your insurance and come down here and get at least know what the problem is, so you have a goal to reach with the price and how much it's going to cost to fix, what your recuperation time is going to be. I've had 2 implants done in my jaw from the wreck where I shattered teeth and had problems with that down here. The cost for implants for your mouth are a third as the U.S. A crown is $375.
And you're happy with all of it. Everything's been...
They did a perfect job. I also was told I needed a sinus cavity lift in the U.S. operation before they could do implants. The doctor down here said, oh no, we just have to make a little adjustments. Instead of putting the post in this way, we put it at a slight angle. Then there's plenty of room, and you don't need to go through that painful additional surgery that's really not necessary.
Man, what happened in the United States that they do this?
Money.
This is a shame.
It's all driven about money and drugs, and the more they have you addicted to drugs and the problems the drugs cause, guess what? The sicker you are, and they continue to get your money.
And they have you for the rest of your life.
Exactly.
Oh man, this has been great. This was a total score. It was nice meeting. It was great meeting you, and I think that we're going to get a lot of people people writing? Who's our doctors?
I just want to help people not have fuses anymore because it's life debilitating, and every single person that I've had conversations with that's done that says it's the worst thing they've ever done in their life, that felt that that was the only option because the pain was so intense. They didn't even care anymore. It was just so painful. And there is other options, and they aren't that expensive, you know, depending on what your problem is. And it's a very fair price here. You're not paying 50 grand for a doctor to go ride in his car. You're paying him fair time for what he does for you. And it's the best feeling ever. So
cool.
I wish everyone good luck. And
Valerie, thanks so much for
Glad to
talking to
help.
us. This is great stuff. Anyway, guys, I'm Michael Allen, TravelCostaRicaNow.com. Peace, guys. Hope it helps.